Hello, my name is Robert Bache, MedicareBob. I own Senior Healthcare Direct, and we help people nationwide with their Medicare coverage. In this video, we're going to talk about Aetna and what Medicare Supplement Plans Aetna is offering for 2020. Aetna is offering most of the Medicare Supplement Plans: Medicare Supplement Plan A, Plan B, Plan C, Plan G, Plan F, Plan N, and also a high deductible Plan F option and a high deductible G option I'm sure is coming as well. Aetna has some really good household discounts. They're actually coming out with a 14% household discount on their Medicare Supplement Plan G. Aetna's been doing Medicare supplement insurance a long time, as well as other types of insurance. I do recommend them. They are an A+ rated carrier. So let's start talking about the plans that they offer. Medicare Supplement Plan A is your most basic Medicare supplement plan. It essentially is going to pay, I'll put the chart behind me so you can get all the details, but I'll kind of summarize them as I touch each plan. So Medicare Supplement Plan A is your most basic plan, and it's going to cover the 20% that Medicare doesn't pay. So you'll have to pay your Part A deductible, which is around $1,400. So that means every time you go in the hospital, you have to pay that $1,400. You'll have to pay your Part B deductible, which this year is $198 for the year. And then after you pay that, Medicare will pay 80%, and if you have the Plan A, it will pay the 20%. Another plan that's offered is Medicare Supplement Plan B. Plan B is an okay plan. What's nice about Plan B compared to A is it does actually cover your Part A deductible. So it is going to pay the $1,400 that Medicare would normally charge you every time you go to the hospital. It doesn't pay the Part B deductible, so you have to pay that $198. Medicare will step in and then pay the 80%, and then the Plan B supplement plan will pay the remaining 20%. Neither Plan A or B pay for Part B excess charges or pay for the foreign travel benefit. That's nice, that some people like as well. So another plan that Aetna and other companies offer is Medicare Supplement Plan C. Plan C is, you can only qualify for Plan C if you were eligible for Medicare before January 1st, 2020. So if you were on Medicare before that, you're eligible for Plan C. If you were not on Medicare till after January 1st, 2020, you cannot purchase the Plan C. Plan C is going to be the second most comprehensive plan. It's very similar to a Plan F, which we'll talk about in a moment. It's going to pay the Part A deductible, the Part A coinsurance, the Part B deductible. It's also going to pay the 20% that Medicare doesn't pay. What Plan C does not pay is it does not pay for the Part B excess charges. So Plan C used to be a pretty popular plan in areas where Part B excess charges are not allowed to be charged, like Pennsylvania, New York, some other states. Another plan is Medicare Supplement Plan D. Plan D is going to pay the Part A deductible, so it pays the $1,400. It's going to pay the Part A coinsurance. It's going to pay the Part B coinsurance, the 20%. What Plan D does not pay is the Medicare Part B deductible, which is $198, and it does not pay Part B excess charges as well. A lot of people get Plan C and Plan D confused with Part C and Part D, so it's really important that you make that distinction. Medicare Part C refers to Medicare Advantage plans. Medicare Part D refers to prescription drug coverage. Medicare Supplement Plan C, Medicare Supplement Plan D are the two plans that we just talked about that Aetna offers. Another plan that's offered, again, is Medicare Supplement Plan F. Again, like the Plan C, you can only get the Plan F if you were eligible for Medicare before January 1st, 2020. If you were eligible after Medicare for January 1st, 2020, then you cannot get the Plan F. Plan F is going to pay essentially all of the holes on this chart that you see behind me. It's going to pay the Part A coinsurance, Part A deductible, Part B deductible. It's going to pay the Part B coinsurance. It has the foreign travel benefit. It does pay Part B excess charges. My favorite plan is the next plan, Medicare Supplement Plan G. I call that the greatest value. Aetna is offering Plan G. They actually are rolling out a 14% household discount in some states starting March 13th of 2020. Plan G is my favorite plan. Plan G is going to pay the Part A coinsurance per day stay. It's going to pay the Part A deductible, so you won't have any hospital bills. It's going to pay the 20% that Medicare doesn't pay. It's going to pay the foreign travel benefit, and it also pays the Part B excess charges. The only hole in the chart behind me, or the only thing that Medicare Supplement Plan G does not pay, is the Medicare Part B deductible, which is only $198. Once you pay that deductible, you're not going to have any more out-of-pocket costs for Medicare covered services. Medicare Supplement Plan G is my favorite. And it's probably going to be my favorite the next 5 years. It's been my favorite the last 5. I think it's going to have another good 5 to 6 year run of being my favorite plan. The last plan we're going to talk about is Medicare Supplement Plan N. I call Plan N not fixed. Medicare Supplement Plan N is a good plan. It has 4 out-of-pocket potentials. It's going to pay the Part A per day stay. It's going to pay the Part A coinsurance and the deductible. It's going to pay the 20% that Medicare doesn't pay. It covers Part B excess charges and foreign travel. So those 4 out-of-pocket costs are the following. If you choose Medicare Supplement Plan N, you will have to pay the Medicare Part B Deductible, which is $198. After that, you'll pay up to a $20 copay per doctor visit. So that's for primary or specialist. The most any provider or doctor can charge you is up to $20. With that, the third out-of-pocket cost with Plan N is if you go to the ER, you're going to have a $50 copay. Now, if you're admitted, that's waived and it will pay your $1,400. But if you do go to the ER, you have a $50 copay. And then the last item that Medicare Supplement Plan N does not pay for is the Part B excess charges. So that's what you would have to pay if you have Plan N. Now, there's a lot of people on YouTube and on Facebook and some agents that are recommending Medicare Supplement Plan N. Plan N is one of our more popular plans that we're offering, but we're still, when we do help people with supplements, 90% of our clients are still choosing Plan G. Plan N is a good option that people like because it has a lower premium. But the reason it has a lower premium is you have those 4 out-of-pocket costs with the $198, the $20 copay for the doctor, $50 copay for the ER, and Part B excess charges. So, and the spread between the best price Plan N and the best price Plan G with Aetna, on average, is around $18 a month. So if I'm helping you, one of our agents we'll give you both options. It's your choice. We're a big fan of educating you, and then you choose the right coverage for you. But when we do the math, we are still recommending the Aetna Plan G over the Aetna Plan N because it's about $18 more a month, and you don't have to worry about the Part B excess charges or any copays. With the Aetna Medicare Supplement Plan G, all you have to pay is that $198 deductible. Aetna has some value-add services as well. They do also offer their own dental plan and vision rider that you can get with the supplement plan. And Aetna, they process their claims out of Tennessee. All of their employees are in the country. And they're great. They're a great company. We've been offering them for many years. Their rate stability is on par with all the other good companies. So if you're interested in Aetna Medicare Supplement Plan or learning more about your supplement, I'll drop a link in the description below to our website where you can pull your own quotes. Also, our phone number will be listed in the video, so you can give Senior Healthcare Direct MedicareBob's office a call, and we'll get your Medicare done right.